Tack. Då ber jag Thomas Ragnarsson göra sig redo och ordet går till Elsa Widding, partilös. Varsågod.
Tack herr talman. Jag har en fråga till socialminister Forssmed. Nyligen så kom Statistiska centralbyrån med siffror som visar att barnafödandet i landet är på en historiskt låg nivå. Ner med 8,6% för 2022 och 12,9% för 2023 jämfört med 10-årstrenden. Och de här siffrorna är statistiskt säkerställda. Och man har också tillhandahållit siffror som visar att överdödligheten i landet är på 5,1% för 2022 liksom för 2023. Och även den här förändringen är statistiskt säkerställd. Och om nu vaccinerna mot covid-19 hade varit säkra och effektiva så skulle vi kunna förvänta oss en lägre en underdödlighet. Så min fråga till statsrådet är om Socialdepartementet kommer att tillsätta en oberoende utredning för att utreda eventuella orsakssamband med vaccinationerna. Tack.
But as a consultant paediatrician, I'd like to focus on children. The Child Mortality Database, National Child Mortality Database, collates data regarding children's deaths from 0 to 18. Their latest bulletin from March 23 shows there were sadly 3,743 child deaths to the end of March 23, which is an increase of 8% on the previous year. So could the Minister comment on her investigation she's doing into the cause of this increased mortality and what's being done to prevent further deaths? The purpose of CDOP is to investigate these deaths, but the average investigation is taking 392 days, with less than half completed within 12 months and a significant fall in the number being completed within 12 months. Can I ask what she's doing to improve this process? One particularly distressing feature of child death data is that suicide or deliberate self-harm was the primary cause of death between children between 10 and 17 years. And looking at the data, it's getting much worse within children 10 to 14. I understand the government's aware of these figures and is investing in mental health for children and improving online safety, but we're grateful if the Minister could elaborate further on the steps they're taking to support children and prevent further tragedies. One of the reasons I get exasperated... Sorry, I'm finishing this. One of the reasons I get exasperated with the COVID inquiry is there seems too much focus on who said what to whom. Did someone swear? Did the actors like each other? I'm not that interested. I want to know what lessons can be learned. Was lockdown useful? Is getting children out of school useful? Was the vaccine a suitable thing to give children or not, particularly if they'd had COVID before? These are the answers that we need.
Sir Gary, the eyes of history are upon us. Every generation looks back in wonder at the incredible mistakes of our forebears. They will ask questions such as how could they possibly realise how wrong they were? What on earth happened to them? Why did they ignore the evidence for so long? Their values and every opportunity to learn from the mistakes of yesteryear. What madness captures men. From 2010 to 2019, annual death rates in England and Wales oscillated between 484,000 and 542,000. In 2020, there were 607,000 deaths, 65,000 more than the maximum in 2018. In 2021, there were 586,000, which is 44,000 more than the 2018 figure. After such a rise, there should be a deficit, a significant deficit. In fact, because sadly, our most vulnerable and elderly, who might have lived a while longer, were taken from us early. But in 2022, there were 577,000 deaths in England and Wales, and in 2023, 581,000. A huge rise when, in fact, a significant deficit would and should be expected. The deficit, and then some, has been filled not with the extremely old and the extremely vulnerable, but with others, many, many others, who are often young or in the prime of their lives. You might want to ascribe the excess deaths in 2022 and 2023 to the virus, but that would be a mistake. That's not what their death certificates say, and moreover, there are far too many young people dying. Far from being below the recent rolling average, excess deaths in 2022 have been above. 6% above, in fact. In 2023, when one might expect deaths to finally fall below the average, the excess has also been 6% above. These numbers are higher in the younger age groups. No one with integrity can fail to be troubled by these figures